I'm honored to be joined today by a number of people that will have the opportunity to address the current situation that we find ourselves in as a nation and as a state. This is obviously a somber time for our country and for our state. We are all in danger from coast to coast. As leaders, our top priority is and always will be the safety of our citizens. Every day for the last several weeks, we have met with our health experts, we've had conversations, and ultimately we have asked and discussed when is the right time to do various things. In other words, when is the right time, or is it ever going to be the right time, to issue stay-at-home orders, shelter-in-place orders, either for local jurisdictions or for the state as a whole. Late yesterday afternoon and into the evening, as more and more data began to arrive, it became clear in talking to our experts that time was near. They told me that we are now at the point in Mississippi's cycle where such drastic measures may be required. Today is the day. We are announcing a shelter-in-place order. It will go into effect Friday at 5 p.m. I'm going to sign it while we're here. I will let our top health official, Dr. Dobbs, talk to you and explain his thought process behind the timing as well as the data that backs this up. I really just want to take a moment, though, to offer a simple message to my fellow Mississippians. This will not be easy for anyone, but we believe it is the right course of action. We know that there are many people across our state who are scared, wondering what this means for themselves, for their family members, and what this means for their wages and their ability to put food on the table. We are here for you and working hard to help. Mississippi will not allow you to fall without a helping hand. We know that there are some who still do not have a healthy fear of this virus. They are wrong, and they are risking lives if they do not take this very, very seriously. While they may not be risking their own lives, they certainly are risking the lives of their moms, their grandmoms, their dads, their granddads. This order will be enforced. It will be taken very, very seriously. It will not be forever. We will get through this and open our state back up as soon as possible and as soon as our health experts tell me it is wise to do so. As was said yesterday by Dr. Byers, as I'm sure Dr. Dobbs will say today, shelter-in-place orders are not sustainable for months and months and months on end. Our goal in the short term is to prevent our healthcare system from being overwhelmed. I pray that all of our orders and our preparations will be enough. We believe that this is the right tool at the right time to save lives. Today, this is the best course of action for Mississippi. At this time, I'll turn it over to Dr. Dobbs for some more information.
Okay. Thank you, Governor, and thank you for your leadership on this issue. Remarkable time in our history, no doubt. If we look at what's happening in Mississippi right now, since yesterday, we reported another 136 cases of COVID, another 2 deaths, putting our total case count over 1,000. One of the things that's become most worrisome is we've seen an expansion in the number of cases in nursing homes. So we're seeing at this point enough volume of cases where it's starting to infiltrate into a more vulnerable population. If we think about what the purpose of a shelter-in-place order is, it's to slow things down, to give the system an opportunity to get extra capacity to deal with the increased demand. And part of that's going to be the healthcare system. If we think about our ICUs, we have adequate ICU beds right now. If we think about ventilators, we have adequate ventilators, not in use in hospitals right now. But we know more cases are coming. We know that we're going to have more deaths. We really are still at the front of this thing. But if we can use this tool to slow things down such that we can process patients through the system safely and provide every single patient the resources they need to maximize a chance for recovery, that's what we're doing. And this isn't going to be a cure. It's not going to stop the coronavirus. What it will do is it'll cause an additional pause. The social distancing measures have been useful, but this additional measure will be that much more useful to slow it down so that we can not only make sure the health system has the capacity to deal with the patients that are coming through, but also for us to be more aggressive in our offensive strategy, tracking, identifying, isolating, quarantining all appropriate individuals to contain it from a microscopic environment.
Thank you, Dr. Dobbs. I have been in contact with Speaker Gunn, Lieutenant Governor Hoseman, and their leadership teams, as well as mayors and members of the Board of Supervisors all across the state of Mississippi. We have constantly been in contact with them over the last 3 weeks, and will continue to do so. When speaking with Speaker Gunn earlier today, he offered to come and make a few comments today. I'm honored to have him by my side. We've worked closely for 8 years, ensuring from a financial standpoint and otherwise that we as a state are prepared to deal with this. And so, Speaker Gunn, thanks for being here, and I'll turn it over to you.
Thank you, Governor. I am here today just as a sign of support for this decision. I will tell you what got me to this point. My number one concern this entire time has been the health of our citizens. I think that is paramount. I think every one of us needs to be concerned about what is the best thing for the health of our citizens. This morning I had a conversation with our 2 leading health professionals in the state, Dr. Luann Woodward and then Dr. Dobbs. And I asked them both, if you did not have to have concern for political or economic or any other ramifications, if you were just making a decision based on what is in the best health interest of the citizens of our state, what would you do? And they both said, this is it. So that was convincing to me that this is the step we now need to take. And for me, that is what led me to this point. We are at a point now where we've got to do this. We do not want to be in a situation where we have not done everything that we can possibly do to protect our citizens. And when I asked that question and they said this is it, and that convinced me. So I called the governor at that point and I said, look, I'm convinced now this is what we need to do. If you need me to come and stand with you at the press conference, I will. And he invited me to come, and so that is why I'm here today. I want us, whenever this is over, to look back and say we've done everything we can possibly do. We've been warned by the president. We've been warned by others. There are going to be deaths. There are more people going to die. That's unfortunate. But I don't want them to die because we didn't do everything that we could do. This will hopefully slow down the spread of the virus. We do not need our healthcare system to be overwhelmed. We have a limited number of beds, limited number of ventilators. At this point, as I understand it, there's no one in the state who is in need of either that doesn't have it. But if we have a tremendous outbreak, it could be to that point, and I don't want it to be said that someone died because we couldn't provide them the health care that they needed. And I think this is the proper step to take to make sure we don't get to that point. We can always overcome the economic stuff, but we cannot overcome loss of life. So I am supportive of this, and that is the reason I'm here today. Thank you, Governor.
Thank you, Mr. Speaker. I appreciate your support. At this time, I'm going to ask General Bowles to come up as well. One of the things that we have been doing over the last 3 or 4 weeks, working with Director Michelle, working with the team at MEMA, and of course working with General Bowles and his team, as we have been preparing for this crisis as the curve begins to move upward. And I wanted to ask both General Bowles and then once he is done, ask Colonel Michelle to come forward and talk about some of the efforts that have been ongoing to help ensure that if it becomes necessary that we do things like have additional hospital beds, etc., that the Guard is ready, willing, and able to help provide that. Our men and women in uniform, every single time through American history, they've been asked to step up. They have done so, I know, under the leadership of General Bowles and the high quality and competency of the men and women in the Mississippi National Guard. They'll do it again, and they'll do it well. General Bowles.
Thank you, Governor, and I will reiterate what Dr. Dobbs said. We truly appreciate your Dr. Dobbs, we appreciate your agency's leadership also as we continue to support you. The National Guard has about 100 soldiers and airmen currently mobilized to support the state of Mississippi. We recognize that the Mississippi State Department of Health is the lead agency on this task force. We work with our partner, MEMA, to support the Department of Health. We currently are supporting in 3 ways. We are providing planning and logistical support to the state for their efforts in this exercise. We're shipping product all over the state of Mississippi currently. We are providing security support to first responders if needed. That means that we would never be the lead in a security situation. We would always be in a support role to that local government if needed. And then our third is to always support our fellow agencies. Currently, we are prepared to assess any facilities, Governor, that you may need assessed with the engineers in our formation, and we're prepared to do that also. So along those 3 efforts, logistics support, security support, and then partnering with our local agencies. Governor, that's all I have.
Thank you, General Bowles. Appreciate you and your team's efforts in planning and preparation for the days and weeks ahead. Thank you, sir. At this time, I'm going to ask Colonel Michelle, the Director of the Mississippi Emergency Management Agency, the lead agency for preparation and management of the emergency itself. Colonel Michelle, could you talk a little bit about your efforts over the last several weeks and what you see in the coming days and weeks ahead?
Yes, Governor, thank you. One of the things that has been one of the more challenging issues with the COVID response has been, of course, getting the appropriate supplies in that we need for, first of all, our healthcare workers, healthcare providers, healthcare facilities, and then our tier 3s, where our first responders, emergency responders. We've been working. This is not an issue just for Mississippi. This is an issue that's been global. This is an issue that's been nationally, all states been working with, but we've been working with great success and starting to get supplies in. It's taken a little longer to do that. As everyone knows, we've talked with a number of healthcare facilities and hospitals about those supplies, and we certainly understand their concerns, but I can assure you that those resources are coming in, and as was said over there earlier, we're getting notifications of supplies coming in. And one of the other things that, just to address that Dr. Dobbs had mentioned earlier about the expansion of ICU beds, should that need arise, ventilators. We have a team together in conjunction with the National Guard. You heard General Bowles address and talk about their strategic planners and working with us. We will be set to brief the Governor, and General Bowles and Dr. Dobbs on where those expansion capabilities exist, how we would execute that, and also how we'll be resourcing those valuable and critical needs such as ventilators. Thanks to our partners at Mississippi State University that's worked on converting some ventilators that we had that were emergency ventilators, battery powered to AC. We're certainly appreciative of that. And we've had much success here lately with resourcing and finding some ventilators that we anticipate receiving over the next couple of weeks to ensure that we have those resources when the need, if the need arises, to expand those intensive care treatment facilities. Other than that, Governor, appreciate your leadership. MEMA continues to certainly be proud to be a part of this event and continue to resource our partners as we need, sir.
Thank you, Colonel Michelle. Before I open the floor to answer your questions, I just want to say a special thank you to a few folks. First of all, to our emergency first responders, our healthcare workers, our doctors, our nurses, and everyone in the healthcare field that are on the front lines of this response. I want to personally say thank you. You are the heroes in this, and we appreciate you, and we're going to do everything we can to ensure that you have the equipment that you need to continue to provide the quality of service that you are providing. And then secondly, I can't tell you how many emails and texts and voicemails that I've received from people around the state telling me that they're praying for us. That means a lot. It means an awful lot. So thank you very much. And at this time, I'm going to open the floor to questions. Scott.
Governor, how is this shelter-in-place order different from what have been the cautionary warnings we've had in place? How will it change from what people have already been told not to do already?
I'm going to sign it right quick. Minor details,
Yes,
but important ones. I will tell you that for the 75 to 90% of the people in Mississippi who have been adhering to the executive orders that have been issued throughout the state by my office over the last several weeks, this executive order is not going to significantly alter or change their life. What this particular executive order does, and it is very similar to the order that was put in place yesterday for Lauderdale County. It does outline the ability for individuals to continue essential business operations. Grocery stores are going to stay open. Other essential operations are going to stay open, again as defined by the executive order from several weeks ago. Speaking from the Cyber Security and Infrastructure Committee, those guidelines are in place defining essential operations. Some of the areas in which we have decided that we are going to put in writing with the signature here in terms of prohibited activities. They are, of course, all public and private, social and other non-essential gatherings of groups of more than 10 people. But also, this is going to shut down all places of amusement and recreation, whether indoors or outdoors, including but not limited to amusement parks, rides, museums, playgrounds, children's party and play facilities, all parks, including all beaches, lakes, and reservoirs, but not including walking trails. Movie theaters, bowling alleys, and social clubs are being closed. In addition to that, it is going to give us additional ability to enforce these public gatherings. One of the challenges that we're having across the state is, and this is a downside of some businesses closing. You've got certain communities throughout the state where we're beginning to see clusters of people who are not working, and rather than staying at home, they're gathering in groups, and that is something that is leading to transmittal and group transfer. And so this should give our local law enforcement officers more ability to enforce the guidelines. And we are going to be talking over the next, we've already started the conversation, we're going to continue to have discussions over the next couple of hours and days of ways in which we can utilize state resources and state police to help our local law enforcement officers enforce this where it is necessary. One of the things that we have in the state of Mississippi, and one of the areas in which the Mississippi Emergency Management Agency has a fantastic record of working with various state entities, specifically the Mississippi Department of Transportation's law enforcement entities, as well as the Mississippi Department of Wildlife, Fisheries and Parks, Mississippi Department of Marine Resources, and the Mississippi Highway Patrol. We will have each of those interconnected into the enforcement mechanism again. But I want to be clear about something. The single most important enforcement mechanism that we can have in the state of Mississippi is you, the people of our state. If you will self-enforce this, it will go a long way towards slowing the spread. If you will stay at home, unless it is absolutely essential to do so, if you will stay at home, even if you're an essential employee, unless it is going to and from work, then we will be successful in continuing to slow the spread. Gordian?
Can you talk a little bit more about the enforcement piece in regards to, people might be wondering at home, are they going to have any kind of documentation to prove that they're going to work? If the grocery stores aren't closed, then obviously they wouldn't have anything that would prove that. To what extent should they expect enforcement in that regard?
Well, what I would tell you is that if an individual is in their vehicle driving either to work or to the grocery store, there is very little likelihood that they're going to transfer it to themselves or to anyone else. And I'll let Dr. Dobbs speak to that from a public health standpoint. But if we will be smart and we will understand that we practice social distancing, that we don't get within 5 to 6 feet of other individuals, no matter what we are doing, whether in public or otherwise, if we're only leaving our home to go to the grocery store or to the pharmacy or to and from work if you are an essential employee, such as a healthcare worker, etc., then I think that this will be successful. But enforcement is a challenge always. Enforcement is a challenge for every law we have on the books. It is impossible for us to enforce the murder statutes that we have, and unfortunately, people break the law every day. But in this instance, violating this executive order not only puts yourself at risk, but it puts other Mississippians at risk. And though you may be healthy, your grandmother or your mother or your granddad or your dad may not be. And if you were to go out in public and gather with 10 or 15 or 20 people and you contract it, you may take it back to your home where you may live with your grandmother, and you may put her at jeopardy. And so I can't stress enough that the single best mechanism for enforcement is for individuals to enforce it themselves. But we are going to step up law enforcement. We are going to assist local officials ensuring that we don't have large groups gathering on our beaches. And I don't care if those large groups are from Louisiana or from Mississippi or from some other state. We are going to ensure that does not occur effective at 5 p.m. on Friday. It shouldn't be occurring now. It's already against the executive order that was issued weeks ago, groups of 10 or more. But we now have the ability to further resource so that we can help those local law enforcement agencies that need and won't help. We're not going to come in and take over anywhere. We've got the best law enforcement officers of anywhere in the world. We've got sheriffs on the coast all the way through North Mississippi that know what they're doing. If they need help, we want to try to do everything we can. If they'll go through their emergency managers and talk to MEMA to do that. Yes, sir. No.
We've known for a very long time.
You asked a much harder question than the debate than Byron did.
We know for a very long time that this is very contagious. It spreads like wildfires, and we had a lot of it in New Orleans. Did you have to overcome political ramifications and perhaps some economic ramifications to get to this decision?
Well, to be honest with you, if I was going to make the politically easy decision, I would have entered an order such as this weeks and weeks ago. That was the easy decision politically, because there were lots of people calling on lots of different political leaders to make that decision. For me, the decision has always been data-driven, and it has always been based upon the advice of the experts. Today, after conversations late yesterday, and the data that we had gotten in was the first day that our health experts said that maybe today is the day. Now, I will tell you that we had numerous conversations, and I'll let Dr. Dobbs address this as well. We had numerous conversations about the fact that there were some areas of the state that it was more important that we move forward more quickly. For instance, you look at the Mississippi Gulf Coast region, Pearl River County. Just to give you an idea, yesterday in Louisiana, they had 1,212 new cases and 54 deaths. That's more total cases than we have in the state of Mississippi from the entire event, and more deaths than we currently have. And so when you're looking at what's happening down in Orleans Parish specifically, but throughout that New Orleans region, that leads us to make some decisions. We had a conversation through the night and again this morning about the possibility of just expanding this to a few other counties, 5, 6, 7, 8 counties. No, and the question that I asked was, do we think within the next several days that we're going to ultimately get to the point where the recommendation will be we need to expand it much more broadly? And in talking to Dr. Dobbs, and I'll let him address this, we felt like that probably was coming in the days ahead, and therefore, in my mind, it made sense to go ahead and do the expansion statewide. Dr. Alves, you want to talk a little bit about that?
Yeah, no, thank you, Governor. If you look at where we are in our state epidemic, you know, we're well earlier than other states were when they did shelter in place, right? So we have the benefit of seeing what happened where they were. Now, this is going to be disruptive. It's going to be difficult to maintain. The previous measures were actually helpful, and certainly if people had complied, would have been even better. But just because we're starting to see this increase and for a targeted period of time, if we can strongly enforce this to give us a chance to make sure that we don't overburden the healthcare system, that we can adequately resource the healthcare system. We've heard of the challenges that NEMA's faced in getting resources. It's just the right time. And the populace of Mississippi seems ready for it, and I think now's the time where it can be most successful.
Governor Reeves?
Yes.
I know in your order that non-essential businesses are expected to keep their operations to the minimum possible standard in order to continue operations. Are there any expectations that essential businesses, which are broadly defined, will also have to reduce the scope of their operations or institute things like work from home?
That's a great question. And so the one thing I would say is that non-essential businesses are not only expected to only operate with minimum operations, they are required to operate with only minimum operations as defined in the order. And so as it relates to essential businesses, we continue to encourage them to exercise where possible with assuming that they are doing so in a way that the social distancing requirements, the other things that we have already put in place, the gatherings of not more than 10 in small groups are continuing to happen both in essential and non-essential businesses. But when it comes to places like grocery stores, they have to stay open, and we have to protect them and ensure that they stay open. Because we would, if we allowed ordinances or other things to occur that put those grocery store in jeopardy or limited their ability to restock their shelves, etc., then we would see a panic in our state. We do not need to panic. We need to recognize the seriousness of this situation. We need to do the right things, and if we will do that, we will get through this.
Quick follow-up.
Yes, sir. I'll come back. Okay.
I got a question actually for Director Michelle.
Okay.
Director Michelle, you had mentioned that you're getting supplies soon. I was hoping you could maybe go into a little bit more detail about that. I was talking with a hospital up in North Mississippi today who said that for days and for weeks they've been ordering new supplies, basic supplies like masks, and not been getting them. The director of nursing up there told me that she's keeping an emergency stockpile in her office of masks. That stockpile is 10, you know, and so if you could just maybe give a little more clarity and a little more specifics on what is coming in when.
Yeah, and we get a lot of calls like that, and we know that a lot of hospitals are operating in their emergency stash. It's good that they planned that way to have that. We are actually probably 4 days later than I would have liked to have been on getting some of the supplies in. A lot of what we ran into were logistical issues, not necessarily acquiring, getting the supplies finally once we got those pipelines, but actually the trucking piece. The cargo flight piece are so backed up because of the global demand on these products that we've had some delays. We had masks come in today. We've had hand sanitizer come in today. We've got 2 truckloads of more hand sanitizer and sanitizer for floors and for facilities. So all the stuff is coming in. The Mississippi Department of Health has been making regular shipments, although they've been smaller than we would like them to be to the Tier 1 facilities. Although as our cases continue to increase, those Tier 1 facilities also increase. The demand on what we do have is much greater. But we're starting to get visibility on stuff coming in, and as that stuff comes in, we will push it out as quickly as we can.
Is that coming from the federal government? Those supplies, or is that from, yeah, can you explain how that works?
Well, so we did get our last shipment of the national stockpile. It came in 2 days ago. It was, again, a small shipment, but that's what we've been getting of the national stockpile, the 3 shipments that we've received. The majority of what we've got that we anticipate coming in now are things that we've gone out and locally procured with our state resources.
Let me just follow up with that as well. You know, and I've told this story before, and I want to tell it again because I want people to understand the challenges that exist in this entire country and quite frankly across the globe. It's easy for us because most of us were around when Hurricane Katrina hit. When Hurricane Katrina hit, from an economic standpoint, from a financial standpoint, we know the damage it did to literally hundreds of thousands of lives. But from a number standpoint, that disaster was 5 times larger than any natural disaster in the history of our country. But the difference was, for all intents and purposes, it only affected Mississippi and Louisiana. And so the next day, and in some cases the day of Hurricane Katrina, we had help pouring into our state from all 48 other states. In this particular event, every state is dealing with it. And therefore, not only are we competing with the federal government, we're also competing with each other. And quite frankly, we're competing with other countries for this critical equipment. One of the goals of the social distancing that we've had in place for a number of weeks, followed by the shelter in place that we're going to implement here for the next couple of weeks, is to slow the spread of the virus so as to not put too much stress on our healthcare system. That also gives us some time for manufacturers to actually go out and manufacture more of this PPE equipment and more of the ventilators that we need. It also gives us time to be successful in acquiring more and more of that. That is why I believe this is the right time to do this. As Dr. Byers said yesterday, as Dr. Dobbs said today, as they have repeatedly said to me, a shelter in place for months and months on end becomes impossible to regulate, and it becomes impossible to ensure compliance. That's the reason we put a time period on this particular executive order. It goes into effect at 5 p.m. on Friday. It is scheduled to conclude at 8 a.m. on Monday, April the 20th. Now, as the situation evolves, we will make further decisions, but that is the plan right now. It's just slightly longer than the 14 days that we believe is a realistic period. But we have to make sure that our people understand that if you will comply, and if you will do your part over the next 2 weeks, we'll be able to slow this spread. We'll have better data over the next couple of weeks, and then hopefully we can remove this as scheduled and as planned. Yes, you got to follow up.
Right, follow up. Because of the relatively broad nature of essential businesses in the original executive order, is there any thought to kind of closing down that definition just a little bit for the purpose of this shelter-in-place order? I know obviously healthcare services and grocery stores would not be affected, but is there any thought of limiting that?
No, the essential businesses that were outlined in the original executive order was almost exclusively dependent upon the essential businesses that were outlined by the Office of Homeland Security in the United States government, their Cybersecurity and Infrastructure Task Force. It is critical that we ensure that the supply chain in America continues, because if it does not, then we will not be able to receive the PPEs that we badly need. We will not be able to receive the things that we need to make sure our healthcare workers and others are protected. And so that is now the thing. What we did do in this executive order is we went a step further in outlining those things that are not essential. And so that's why you see us specifically mention amusement parks and rides and museums and playgrounds. You know, one of the things that we're hearing from local elected officials is that in some communities, folks are gathering up at the playground, and while person-to-person transmission is unlikely as long as you're 6 feet apart and outdoors, we're seeing that gathering and that clustering is far more than 10 people or more. And so that's the reason we went further in identifying what those prohibited activities are.
And I want to get along, like, say, the reservoir. If 2 people are on a boat, do they get stopped by wildlife fisheries and tell them to go home? You know, can they go to a liquor store? Is a liquor store considered essential? Where, can you provide any clarity in those areas?
Liquor stores are not going to be closed. The reservoirs are listed here as areas that are going to be closed. And the reason for that is what we saw last weekend, and the weather's beautiful out. What a beautiful day it is in Mississippi today. But what we found is that, not in all areas, and it was fairly limited, but there were certainly, for instance, people taking their boats upriver last weekend and stopping on sandbars, and I can assure you, because we flew over it, some of you were with me, we flew over, and there were definitely people upriver that were gathered in groups much larger than 10 or more, and because of that, we're going to have to shut that down.
Will they be warned first and then arrested? What's it? What kind of pressure are we talking about?
You know, I think there are definitely enforcement measures in here that would allow for them to be arrested. I think most law enforcement officers in Mississippi are probably going to take the initial step and just go in and break them up and say, you can't be here. You ain't got to go home, but you can't stay here. But the reality is that it would be just much easier, much smarter if individuals will comply and not do those things. So, yes.
Just an update on Department of Corrections, have any inmates been tested? What's the update on that situation?
Yeah, so the latest update I received, and I've got to admit it wasn't today, but the latest update that I received was that there is a mechanism in place and a policy in place whereby if any inmate were to be showing symptoms, that they would be sent to the infirmary. They would first be tested for the common flu, as well as other possibilities that could lead to these things. Obviously, this time of year, there's a lot of people, for instance, have sinusitis and things such as that. But I have not been told that any inmate, to my knowledge, that was in a prison facility had tested positive for COVID-19. So that's where we are now. Bobby?
Just continuing on what Scott and some other people are talking about, the essential businesses, just from a practical standpoint. Walmart will be open because they sell groceries, but say a clothing store or telephone stores, so computers and telephones, whatever, would not be open. Is that correct?
Well, I think that if you talk about clothing stores, clearly they should be closed. They're not listed as essential operations in the order. There are a few, not many, but there are a few around the state that said since they were not explicitly listed as being non-essential, therefore they believe they were essential. I don't think that is a reasonable interpretation of this order. Clothing stores should be closed. With respect to, you mentioned computer stores, there's one of the things I will say is we do allow for data operations. I will tell you in these times we do have a lot of kids that are learning from home. We have a lot of kids that are practicing distance learning. And so some of those supplies may fit into the category of being essential. I'll have to get back with you on specifics on that. But again, generally speaking, if you're not listed in the order as an essential business, or if you have to ask yourself, hey, am I essential or not, you're probably not essential. Yes, Courtney?
I have a question regarding the nursing homes, and I noticed that now the Department of Health, you guys are listing some of the counties where there have been problems within those facilities. Smith County is listed. One of the nursing homes there said several residents had tested positive, but only one case is showing up for Smith County. Can you provide any clarity on that, Dr. Dobbs?
I'm not sure about that specifically. I don't know about this one, but a lot of times that would obviously be their residents. But sometimes actually there's a delay, and that's probably what it is for this scenario. But the other thing is, for a lot of the counties, if people's official residence is in a neighboring county, that happens a lot. And so some of those discrepancies come up and gets people really bent out of shape. But there's always been an explanation so far.
Where do we stand on the ventilators, though, and the masks? Are we short now? Are we under-supplied? Are we good? Things like that.
But on the ventilator piece, we have plenty for Mississippians today. It's not today we're worried about, it's next week and the week after next. And so we do a daily inventory of ventilators, and we know how many that we have available. We know that we have an expandable access to ventilators if we start looking at those that are used in operating rooms, because operating rooms are pretty silent these days. So we can expand that pretty quickly, but it's that next phase that we're really worried about. So if we can bend the curve down hard, maybe we'll never need more. So we need to be prepared. But I gave you promotion, sorry. Colonel Michelle has done a fantastic job tracking that stuff. He's been amazing, and I think that we're in better shape because of his work.
Well, real quick on that though, what is the daily number of ventilators today?
It changes so quickly, it's not something we want to publish. And it's also something that people would freak out if they were looking and seeing, oh, it's gone up 10% or down 10%. So it's such a dynamic number that we don't publish it.
Can you speak maybe more roughly then? And
We are below average utilization for this time of year.
Say that again.
We have more ventilators and ICU beds than we normally do available
Right now.
right now.
How many
Do you have a
patients
number
are on
How
ventilators?
many were converted? You mentioned that MSU had converted some. Do you have a number on how many that maybe additional ones that we have in
Sure.
circuit that we wouldn't have otherwise?
Right, so what we had, what the Mississippi Department of Health had was a number of emergency ventilators that were battery powered, that were used during times, using Katrina's example, where individuals had to be transported from a facility that lost power and in transit these battery powered. 500 of those were sent to Mississippi State University. They were received yesterday. They immediately started reworking those, converting them from battery to AC power. So that's another 500 to help and assist as backup serves should they become necessary.
Yeah, and let me just say this also. We met earlier today with these two gentlemen and others, and are looking also at the procurement process, at the potential of acquiring additional ventilators. Again, for those individual states who are spiking today, that is a major issue. The more time goes by before our peak utilization occurs, the more opportunity we have to continue to build on the number of ventilators that we have. But the other thing I'll just tell you, and this is just a fact that we're seeing in other states, and that we are addressing here in terms of our planning phases, is you not only have to have ventilators, but ventilators, and again, this is beyond my scope of expertise, but ventilators don't operate themselves. And so we've got to have competent people and quality people, and so we're calling on all Mississippians who have this level of expertise. You may be retired, you may not be working right now. We are working with State Medical Association and other groups to put together individuals that would be willing to come back and work, or that may, for instance, work at an elective surgery center that is not currently open, but has the capacity and the capability of working ventilators and helping in this situation. We need all Mississippians to step up and be prepared to help us with this. We're not going to hit our peak capacity tomorrow, but it could be next week, it could be the week after that, and so we're working very hard to make sure that in the event of a surge like we're seeing in New Orleans right now, that we have the ability to do that. Yes, sir.
Dr. Dobbs, how many coronavirus patients are on ventilators right now?
That's a really fluid number. It's not something we track readily. But if
Why not?
Well, we're not calling the ICU every day as soon as they're off the ventilator, because it changes very quickly. Now, what we track ICU beds, who's in them, what their care has been, and we know that about 5% of COVID patients that are diagnosed end up in the ICU. And just for extrapolation perspective, about 75% of patients that go in the intensive care unit end up needing a mechanical ventilator.
Well, Louisiana, their Department of Health is reporting every day. They give you the number of hospitalized patients, which y'all don't do because we have to add it up ourselves in the bar graphs. And they're also giving you the number of patients every day of ICU patients right there on their website. So why can't we get that information?
Well, we can work on that if you like.
Thank you.
We'll also follow up on the MDOC question. Have any MDOC corrections officers tested positive for coronavirus?
Not to my knowledge, but we'll follow up on that. I have not been alerted that we have, but I'll check on it. Scott?
Schools, are you ready to make a call yet? That school year is done. Do we start recruiting daycare sciences at this point?
Well, I am not ready to make a call at this point on schools. Obviously, they are closed until what is in effect April 20th, which is the same day that this order would be in effect until. And so my anticipation is, as we get a week or two out and see what the curve does in Mississippi, and kind of where we find ourselves, we'll make those decisions in the coming days. But I just want to be clear, there are an awful lot of Mississippi students who are learning, who are doing assignments, who are doing work, and that's important. And that's one of the things that may come out of this particular event is we're learning a lot of new ways to be innovative. I can't brag on our universities enough, by the way. Greg mentioned Mississippi State working to help us on ventilators. The University of Mississippi Medical Center has utilized their labs to help provide additional testing and found a way to test, and also has done a fantastic job on helping us on testing sites. The University of Southern Mississippi's biochemistry folks and Dr. Bennett has been working with Forest General to also increase testing capabilities. And I think if you look on the Department of Health's website, and I got to give them credit for this, if you look at where all throughout Mississippi there are testing capabilities going on right now, it is pretty broad geographically. I think that's one of the reasons that we are in a better spot than many states, given where we are on the curve from a testing standpoint. We've got a lot of work to do on a lot of different things. None of this is easy, but we have made some real progress there, and I think that's good.
Daycares, are we going to restrict classes to daycares? Or still?
I'll turn it over to Dr. Jobs.
We've had a lot of conversations about what the best practice is. I mean, a lot of daycares have closed and have restricted their practices, but we expect to give them some clear guidance.
Bob?
You talked last week about the big federal money coming in to the states from the big federal legislation. You talked about using that for response. Can you use that money also to fill budget holes that revenue is going to be probably going way down? And do you control that money?
So the answer to the last question is that the bill that the President signed does give control of the money to the governor. It does say in it that you have to use that money on expenditures that were not otherwise budgeted for in the most recently passed budget. Now, obviously, you get 100 lawyers in the room and they could probably debate and argue as to exactly what that means. But I don't think it really allows for the plugging of budget holes. I think it allows for the expenditure of COVID-19 related expenditures to ensure that we can do things. For instance, you know, every hospital in Mississippi, when this became an issue, had a number of masks on hand, not a large enough number, but they had a number of masks on hand, and they had a traditional supply chain in which they typically utilize to put masks in the hands of those employees. Well, obviously those supply chains in many instances have dried up. So we as a state have had to work with the federal government in some instances, but also go out and utilize our own resources to go out and find more of those masks. Those are the kind of expenditures that I would anticipate using that money for. And some of it may also be FEMA reimbursed. And so the thing that I will tell you is we will not do anything in our power to ensure that we have adequate resources for all of our healthcare workers based upon money. We will find the resources to make every possible effort to protect our healthcare professionals and protect every possible Mississippi. Yes, sir.
Yeah, so I know recently you guys have talked about how you've been in conversation with Vice President Pence and his task force, and at that time, the Vice President was not recommending shutting the state down. Have you received any further, I guess, communication from the White House or Vice President Pence on whether or not to shut the state down?
I have not asked in the last several days, and so they have made a decision not to shut down from a national standpoint, and I think the reason they made that decision is because they look and recognize that there are different parts of the country that are different parts of the cycle, and so and they have been very quick to give much latitude to the governors to do what they believe is in the best interest of their citizens. But no, I have not been given guidance by anyone at the White House that this is the right time or not the right time. I've been given guidance by our healthcare experts here in Mississippi, our public health experts like Dr. Dobbs and others, but not anyone from the White House.
The Dr. Woodward's letter correspondence, was that
I've been in constant contact with Dr. Woodward over the last several weeks, and so obviously she is a very vital person in our healthcare sphere here in Mississippi, and I've been fortunate to seek her guidance as well as that of many other professionals over the last several weeks. Yes.
Dr. Dobbs, over in China and other places, Italy, one problem they've had is the healthcare workers become infected. They become virus vectors. I think in China it was like 3,000 nurses and doctors were infected, about what, 30, 40 doctors died. How many of our healthcare professionals so far become infected with this virus? And are we keeping track of that?
You know, we do have that number. We don't post it. We always try to put information out there that balances the needs, you know, the general public, but also that protects the anonymity of different folks. And certainly, as we have more and more people, as you've noticed, we've had more and more information available on the website, and expect to see that. Testing numbers and that sort of thing will be more and more available. But the healthcare workforce is a significant component. But one of the things that people aren't paying attention to, and maybe we can put more to this, is the number of people who are getting it from social gatherings like funerals. That's really been a big problem for us, are these social gatherings. So the healthcare is certainly going to be impacted, but actually a lot more of our cases have come from non-healthcare associated exposures than other group activities outside of healthcare.
But how many have we had infected so far that are healthcare workers?
I don't have that with me, but we're not planning on sharing that.
Well, there have been some.
Oh, yes, absolutely.
Let me just say, I want to say a couple things. Number one, having watched this global pandemic unfold, I have a really difficult time believing some of the numbers that are coming out of China in terms of how many individuals have contracted the virus, how many deaths that they've had, in large part due to what's happening in virtually every other country around the world. I just want to point that out. I don't think we can use the numbers that they are quoting to the worldwide press as necessarily as fact. The other thing that I would say is that it's critically important that we understand that many of the clusters that we're seeing in various parts of the state, and that the data is clear. And what I will tell you is that Dr. Dobbs and his team have done a fantastic job of implementing our strategy, of identifying and isolating where these cases are coming from. And far too often the answer is a funeral, a wedding, and as we go forward, let me just say, funerals and weddings of people of 10 or more and church services of people of 10 or more on Sunday mornings should not be happening. And look, the fact of the matter is Easter Sunday is coming up. Easter Sunday is actually going to occur between now and when this stay-at-home order is completed. And that gives me great heartburn because so many people in society today don't go to church every Sunday anymore, and some of them just go on Christmas and just go on Easter. And so it gives me great reason for concern that Easter Sunday is upcoming and it is in the middle of this in this shelter-in-place order. But for the safety of yourselves and the safety of your loved ones and for the safety of all Mississippians, I have to ask you, do not gather in groups of 10 or more, even if that is on Easter Sunday. It is critically important that we worship every day of the week, that we pray every single day of the week, but we don't need large gatherings of people in small churches. And I think that's, again, it's one of the more difficult things for me to say in this whole endeavor, but it just, from a public health standpoint, is just a fact.
Governor Reeves, is that a suggestion or a mandate?
Well, that is
The
what I'm
gathering
telling, that
church.
is what I
The
am
gathering
telling the people of Mississippi. I have said repeatedly that I don't think that the government can shut down churches, but I do think we can limit their ability to gather. The executive order that I signed several weeks ago makes it implicitly clear that you cannot gather in groups of 10 or more for social gatherings, and I think that fits that category.
Dr.
We've
Dowd,
had some people reach out about hardware stores, Lowe's, Home Depot, gardening centers, about whether or not they're essential or not. Could you offer some clarity on that?
Well, what I would tell you is, I think many of the hardware stores are considered essential under the guidelines that was set forth in the original executive order. One of the things, it's easy for those of us in Mississippi, particularly in the larger metropolitan areas, to start differentiating between this store and that store and this store and that store. But in many communities around our state, you got one store that is the hardware store, and it's the grocery store, and it's everything else. And so, what I would tell you is, no matter that store, if it is open, it is critically important that you exercise social distancing, that you stay within 6 feet, or do not get within 6 feet of the other shoppers. That you, and by the way, many of those that are open have implemented strategies where they make that a reality. If you're in line, for instance, there'll be tape, duct tape on the floors, which differentiates that 6 foot space. And so, whether the store is open or not, you should still, for the good of yourself and the good of your neighbors, exercise those guidelines of not clustering, of staying at least 6 feet apart.
Also, Governor, the order goes into effect Friday, and people will hear things that they want to hear. How do you prevent people from hoarding supplies, saying, oh, it's Friday, we're about to shelter in place, we need to go grab all the bread we can?
Well, what I would tell you is the same thing that I've been saying throughout this situation. The grocery stores are going to stay open because not only are we mandating a shelter in place, we're also saying that grocery stores and those who provide food, including restaurants that now can only provide curbside service or pickup, that those are essential services and they cannot be shut down by any governmental entity. And so the supply chain is working. We have actually, over the last several days, have been working on a number of things such as loosening some restrictions, working with the Department of Transportation to make sure goods and services get to where they need to be so people can get it. There is no reason, even with this shelter in place in order, for you to go and stock up for the next 6 months. Think of your friends, think of your neighbors, go and buy groceries for a week to 10 days as you normally would do. And if you do that, then every Mississippian will have the ability to get what they need, to have the necessary supplies so that we can all, working together, get through this.
There have been some gyms that have been open, some that have shut down. Should gyms be closed down? Should they be allowed to remain open?
Under this order, they shall be shut down.
The gyms have to be shut down.
The gyms will be shut down.
Governor, I hate to do this, but it's unreal. What about construction workers? Which could, like building a house or working on a house or.
Well, I think that what you have to find is, do they fit the category of an essential service as defined under the cybersecurity and infrastructure task force? I think in some instances they would be able to meet the guidelines that they've set forth as essential services, but that's going to be something that has to be determined on a case-by-case basis.
The governor is, while we're piling on, car sales. Car sales, like.
I will tell you again, the executive order that we signed 10 days ago outlining essential services, I didn't commit that page and a half to memory. Let me take a look at it and we'll get back to you.
Okay.
Yeah, Dr. Dobbs, this is something we talked about earlier, but going back to nursing homes, do you know specifically how many nursing homes have outbreaks currently and how many residents are infected?
Yes.
Can you release those numbers? or-
We're releasing the number of counties with it, but as we get more information, you know, again, it's a delicate balance between anonymity and public information. You know, as more numbers accumulate, we can safely release information. So there'll be more information coming in.
So it's
I
like,
want to do a follow-up on the nursing homes. Getting tip calls from readers, and they can't check on their loved ones in nursing homes. Who is responsible for doing that? And whoever it is, are they doing increased inspections? Because some nursing homes, let's be honest, they don't have a great record of taking care of their, whatever you call them, patients. What are y'all doing about that to increase inspections so people aren't just worrying all the time?
Well, our inspectors are still working, right?
But are they increasing the frequency?
We are not increasing the frequency, mostly are doing complaints. Now, I understand that that's an issue, but we are in regular communication, not only with the nursing homes, but also the associations that oversee those homes. You know, we're certainly in a lot now because of the outbreaks we're having, so they're getting a lot of scrutiny when those occur, but we're not increasing routine inspections for the obvious reason, we don't want different people coming in and out of there. We want the stable population of folks as much as we can without bringing in potential.
But people, it's hard for them to file complaints where they're not able to go in there and check on their loved ones
No, I understand.
and see something, report it to you guys.
Right, no, I understand that. I understand what challenge there.
going back to the healthcare workers and PPEs, and you talked about healthcare workers had been affected, but there's been no healthcare workers who had to work in the state, and especially emergency responders without proper equipment. Would they be expected to make calls without the proper equipment?
There is no, right now, by and large, people have what they need, for COVID patients especially. If we have folks who have coronavirus, we've ensured that they have some minimal allotment of protective equipment. Now, there will be scenarios where people encounter people when they don't know they have COVID. And so that's always a challenge. And so we have to be precautious, have precautions about that, making sure we don't. But also, too, we can't have everybody walking around in full PPE all the time. We could do it if we had it, but, you know, really we need to prioritize it for people with known infection. But there's no expectation that anyone would encounter or care for somebody with coronavirus. The other thing that we've done is we have identified the location of people with coronavirus and shared it with local 911 centers, such that if there is an emergency call, that there is a drop-down list where people can know that they might be at risk so that we can maximally protect our emergency responders.
Let me just also remind everyone, because I think this is important. Data still is critically important. Data gathering is still very important. The bill that passed the U.S. Congress and was signed by President Trump on Friday evening requires that we report data to the CDC. We are beginning to accumulate the data from all of the private labs, which is going to help us in terms of having more complete data. We've always had the number of positive cases that they have tested in Mississippi. Now we're in the process of getting and downloading, and it takes time, and the Department of Health is working very hard, but also those cases that were proven to be negative. But we are still implementing our identify and isolate strategy. We talked with Dr. Dobbs today, and he's got 9 different field teams that are working every single day on case management. Again, if you think you have the virus, if you've tested positive, or even if you've tested and don't have a result yet, it is critically important that you isolate yourself. And quite honestly, if you will take it upon yourself to figure out who you've been in contact with the last 5 days, you ought to send them a text and just say, hey, I'm not feeling well. You ought to stay at home as well. Because ultimately, and this is what we talked about yesterday in Lauderdale County, and we now are building out resources to do it statewide, we are going to do everything we can to enter legal orders to make sure that we mandate that those individuals are in isolation or in quarantine. And those individuals, and this is in the order as well, those are individuals that will not be allowed to move freely because we don't, if they are a known positive case, they need to isolate and they need to be away from everyone.
With the stay-at-home order, what are you guys doing to protect homeless Mississippians? And are there special considerations being done for those folks?
Well, that is obviously something that we are working on as well. We have, I know, I have heard of at least one case in one community of a homeless person that contracted COVID-19. And again, this was all anecdotal. I don't have the data, and I can't tell you exactly where it was. But I will tell you, we have exceptionally kind and generous healthcare workers throughout. That particular patient was treated, and they were working to find that particular patient a place to go. And again, I can't. The reality is, in many instances, this feels like the worst of times in our state. But what we know as Mississippians is, in the worst of times, the best of people come out, and we are seeing that every single day in every single community in every single county across our state. Yes.
Governor Reeves, right now there's an eviction freeze as a result, but is there any thought of doing a rent or a mortgage freeze?
There is an eviction freeze that is in this executive order. It was in the one that we issued yesterday. It is in the statewide order. There has been no conversation about a rent freeze or anything along those lines, and I would not anticipate that there will be. What you find is that with the bill that passed the U.S. Congress on Friday and signed by the President Friday night, there are significant provisions for those who lose their job because of COVID-19. There is significant additional unemployment insurance that is funded, and everyone will ultimately be expected to pay their rent and what they owe over time. Now, there are tremendous resources to help them do that, but they will be expected.
And a very quick follow-up.
Sure.
If someone, I believe this is in the CARES Act, but I want to make sure it applies to Mississippi. If someone quits their job specifically because of COVID-19, they are eligible for unemployment in Mississippi.
I think that'll be a question that we'll have to ask Jackie Turner, Mississippi Department of Employment and Security, because state law to apply to receive benefits of unemployment insurance, it is that state law is that you lose your job at no fault of your own. And so I think there's some conversations there. That language may or may not apply to that which is in the CARES Act. And so those are things that the lawyers are looking at as we speak. And hopefully sometime soon we're going to be able to have a sit down with Department of Employment and Security personnel and have a frank conversation where it's on video so more and more people can get that information.
And that'll be, okay.
So it'll be upcoming.
Following back on the question about homeless Mississippians, a lot of housing challenged folks often find themselves maybe living in a motel maybe for a week, or these extended stay motels. Would the eviction, the hold on evictions, would that apply to extended stay motels, or maybe a hotel where you're living there for a week?
It says residential premises during the shelter in place, and so that specific example, we'll just have to look at it and see, and we'll talk to the lawyers and get you an answer.
Okay. Thank you.
Just to follow up on unemployment, we still having viewers call us, email us about whether or not they're going to receive benefits, one. Two, they're still having a hard time getting in and to apply. What is your response to those Mississippians concerned about that?
I'm concerned about that also, and the individuals who are complaining about that and are concerned about that are justified in doing so. Our total unemployment claims were up 5,500% week over week. We had literally, I believe, less than 1,000 claims 2 weeks ago, and we had almost 6,000 claims last week. This is something that is not unique to Mississippi. Our total increase in claims was up about half of what the national average was. So every state's having these same problems. So here's what I say to those of you who are trying to apply. Number one, when this started, our call center was open from 8 to 5 days a week. The call center is now open from 7 to 10, 7 a.m. to 10 p.m., 7 days a week. Every day we are training more people to get on those calls. We have loosened the restrictions, and now you can go through The local WIN job centers to apply for unemployment insurance, we haven't allowed that in the past. Those are actually closed to the public, but you can go on their website, you can send an email, and you can get individuals to help you file those claims. But the most important thing I can tell you is we have waived the 1 week restriction. Historically, you've had to wait 1 week before you could apply for unemployment insurance after losing your job. We have waived that. The federal government, to their credit, actually funded it in the CARES Act. They funded it long after we waived it, but they did fund it, so that's not going to hurt our trust fund. And the other thing is, you are going to be eligible for benefits based upon when your termination date was, not based upon when someone answers the phone at the Department of Employment Security. In addition to that, you're going to be eligible for all of the benefits that you're eligible for based upon that particular date. I'll give an example. The unemployment benefits are increased for those who lose their job for COVID-19 over a period of time. It's going to take the Department of Employment Security 10 days to a couple weeks to actually redo their computer model so that those benefits can be paid. But everybody's going to get paid back to the date at which they became eligible, not the date at which they actually filed it. So those are great questions, very fair questions, and ones that we are trying to get that information out. Yes, sir.
Dr. Dobbs, as of last week, we were still looking at the kind of South Korea model that you described. How is the overall strategy changing in Mississippi?
Oh, this is part of the same strategy. I mean, this is just the timing to help. You know, we talked about having targeted interventions, right, in locations to slow it down so that we can launch EPI teams. The EPI response teams have been activated, and they're out on the field working today. So the timing's perfect. I mean, for implementing the slowdown sort of thing. So this is just a more aggressive defense while we're continuing to implement and ramp up our offensive strategy.
Yeah, and I think that's a great point. Our strategy has not changed with implementing and instituting this shelter at home for the next 14 plus days. Our strategy is the same. We want to go on offense. We have sent out 9 different teams that are capable and competent, that are identifying and isolating those cases. We are continuing to send mobile testing units. We are in Meridian today doing mobile testing. We're going to identify those that are positive. We're going to, and by we, I mean primarily the assets of the Department of Health, supported by MEMA and the Guard. They're going to continue to do the mobile testing units so that we get to every region of our state. We continue to believe that the more tests we do, the more likely our offensive strategy is going to work. But we also know that the more tests we do per capita, the more positive cases we're going to get. So no one is in the least bit surprised that we are seeing more cases every single day. But that doesn't mean that we can't continue to focus on the offensive. We're on the offensive trying to gather supplies. We're on the offensive trying to identify and then isolate positive cases. And honestly, I think where we find ourselves today is in a point where we're making progress on slowing down the spread of the virus. This is just another defensive mechanism that allows us to hopefully get more people to comply so that we get a stronger compliance from people throughout the state.
What is the follow-through like with the teams and the investigation? Obviously, that front-end part is so important, but what is the follow-through like once someone tests positive? Do we anticipate numbers at some point being released about how many have recovered, or is there a team checking back after a certain number of days, or is that only those hotspot areas?
Yeah, well, the state's a hotspot essentially, so you know we'll be doing it everywhere. The first phase, this is labor intensive now, with this many cases and new cases coming on. So our first priority is to identify and do the contact investigation, do the isolation, legally binding isolation, legally binding quarantine order. And as we get that built out, then we'll start layering on top those other sort of supportive mechanisms.
Just want to follow up, in the original executive order, it does list automotive sales as an essential business, and we're receiving reports from readers that they are actually being required to come in and work. Is that intended?
Well, I'll just have to take a look at that. I don't know the details. I don't have it in front of me, but I'll take a look at that and we'll get back to you. Thank you. Seeing no other questions, I do want to just point out that today is Census Day in Mississippi.